but sorry, she threw me off. And my
Why don't you
defense.
introduce yourself? Back to the audiences.
So my name is Emmett Schilling. I'm the Executive Director of Transgender Education Network of Texas, or TENT. And we're here Leal, is that okay? Here talking to Michele Leal, who's running for District 148. And can you tell us a little bit about yourself to kind of frame out our conversation here?
Sure, absolutely. Thank you all for having me, and thank you for hosting this conversation tonight. I think it's really important, especially for District 148, given the reputation and legacy of Representative Farrar. And
Can you speak up just a little bit more?
Yes.
Thank you.
Okay. Is that better?
Yeah.
Okay. Sorry, just don't want to get the mic going again. But I am a third-generation Houstonian. I come from a family with a long history of public service and civic engagement and community activism. And because of that, that's been always a part of my value system, and I've always been very passionate about service and have done that throughout my professional career and all of my adult life. I have worked in the Texas legislature in both the House and the Senate, and then I've worked in the nonprofit sector for a number of years. I worked around healthcare, access to healthcare issues at a community health centers, one part of the safety net healthcare system, and I also worked on legislative advocacy around strengthening the safety net healthcare system and access to care issues, and then I've worked extensively on behalf of the LGBTQ community in my work at the Montrose Center, and then also with an organization called the Lesbian Health Initiative, which focuses around many of the issues that Planned Parenthood addresses, as well in terms of access to healthcare and cervical and breast cancer screenings. And I've been very involved in the community and focused around issues of women's empowerment and Latino community empowerment as well.
Okay, thank you. That was a very long resume. Lots of experience. So our first question is, how have you been involved in the fight for reproductive health rights, which I think you expanded on a little bit, but you're welcome to give us some more information. And then following up on that, how have you been personally impacted by these issues, and what personal experiences shaped your perspective?
Sure. So, healthcare is a huge passion of mine, and access to healthcare, and particularly access to care for women and reproductive rights for women. And I was really fortunate to grow up in a household that had a very strong position about that in terms of women having the right to choose what they did with their bodies, and it was very inspiring to me to grow up with a father who was an elected official and a political activist who said that part of the reason that he did this work is because he didn't believe that men should be legislating what women are doing with their bodies. And that's always resonated with me and always been important to me, and something that I've tried to live by in the work that I've done in the legislature and the work that I've done in the community health center and in the safety net healthcare system. I've worked with a lot of organizations that have been close collaborators and partners with Planned Parenthood, and have been very familiar with the work of Planned Parenthood, and have visited Planned Parenthood facilities, have attended Planned Parenthood events, and without sharing anyone else's personal story, I would say that there are a lot of people in my life who have had access to Planned Parenthood services, or the kind of services that Planned Parenthood provides, and there are people that are not, and the impact of both of those things is very significant.
So Planned Parenthood health centers work to provide the best possible care while ensuring that every person who comes through the doors feels welcome, comfortable, and cared for, no matter what. For example, Planned Parenthood Gulf Coast is proud to offer gender-affirming hormone replacement therapy. How will you fight for inclusive healthcare for all of your constituents?
Sure. So that's inclusiveness and equity is a big part of the work that I do every single day, and in the consulting work that I do, and it is some of the experiences in working at the Montrose Center and working on LGBTQ issues and equity and inclusion issues that led the firm that I work for to expand to offer diversity and inclusion services focused on LGBTQ diversity and inclusion, and it's these exact issues. It's ensuring that providers are affirming with their language and their forms and their interaction with patients, and ensuring that they have adequate education about how to treat all of their patients, including the LGBTQ community and other marginalized communities. And I think that's extremely important to me and something that I do day in and day out in all of the work that I do, and that's absolutely something I would want to bring to the work that I would do in the legislature.
Great, thank you. I think we have a little bit more time. Wonderful. So a question that we had for one of the earlier speakers was talking about SB 22 that impacted local partnerships with Planned Parenthood. It bans Planned Parenthood from partnering with cities, counties, public health departments, and community colleges. If you were elected, would you author a bill to repeal SB 22?
Absolutely. Not only does it ban Planned Parenthood from those partnerships, but it discriminates against a lot of women, and it particularly discriminates against low-income people and people of color and in the LGBTQ community, and it's just not acceptable. And I'm a big believer in collaboration and partnership, and I'm also a big believer in evidence-based healthcare services. And when we have providers out there that are offering quality, affordable, affirming, evidence-based services, we need to strengthen and support them.
Great. Well, thank you so much, Michele, for being with us today. We appreciate your time.
Thank you.
Thank you.